This is TV-20 News at noon.
Good afternoon. I'm Amanda Decker. 21 years ago, when Representative Cliff Stearns took office, the national debt was at $214 billion. Today, it's over $11 trillion, and that number is still growing. This afternoon, we are joined by Representative Stearns, and he's here to talk to us about recent spending and health care and things moving through the House. Good afternoon to you. How are you today?
Fine, Amanda. How are you?
I'm doing well, thank you. Now, first of all, Representative Stearns, I'd like to talk to you. You are opposed to a recent spending bill that will cut defense programs, something I was reading on your website. You say it will reduce defense emergency supplemental funding by 22%. It sounds like a large amount, especially when we are at war in both Iraq and Afghanistan. What exactly will be cut by this 22% cut here?
Well, a lot of the money was being used for programs that were not directly going to defense, and so at that point, if you're not spending the money completely for defense, then you shouldn't be reducing the money from defense and use it for other programs.
Now, President Barack Obama and the insurance industry, they've been going head-to-head over the future of health care, something that today he's going to discuss in a town hall type meeting. And even yesterday, Senator Mitch McConnell said that some lawmakers are worried that we could be headed toward a single-payer health care system, something that is used in many European countries. Where do you stand on this issue heading into tonight's town hall meeting?
Well, your point is well taken. A lot of us concerned about the cost. The Lewin Group found that it's going to cost $3.5 trillion. And going to your earlier comment about the deficit, right now the Secretary of Health and Human Services said she doesn't know how they're going to pay for this $3.5 trillion health care bill. And secondly, they're not sure it's going to save. And thirdly, they're not sure it's going to have complete coverage for everybody. So that's why I've supported a health care bill that improves the present system. I think we all agree that the present system is not providing universal access as well as universal affordability. And so we should allow people like the realtors to get health insurance through associations. We should look at liability reform. We should make sure that people can extend health care when they move from state to state, and also allow their dependents to stay on their health care bill longer, and do some of the things that I think to improve the present system instead of throwing the whole system out and putting in a government-mandated run healthcare system, which is going to be an enormous cost to us, and at this point we're not sure it's going to work.
Now let's talk for one moment here about unemployment. The unemployment rate in some parts of north central Florida, as you well know, in the double digits in Marion County and some other spots. What are some proposals that you see being worked on in Washington that could in turn have a positive effect back here in north central Florida?
Well, you're right, Amanda. In my hometown of Marion County, we're at 12.2%. Obviously, the real estate market is in a very severe decline, and that's causing the problem. I'm having a homeowners workshop throughout the congressional district in July, in which homeowners can actually come in and get, through mitigation, their loans improved upon. And I'll have more and dates and specific times. We're bringing HUD. We're also bringing Freddie Mac and Fannie Mae down. We're also bringing local banks in so that we can also give options to people that look like they're in foreclosure or perhaps having trouble with their mortgages. So that's one thing I'm doing, which I think is proactive.
Well, thank you so much, Representative Stearns. We appreciate you speaking with us this afternoon, and you take care. The best to you.
All right, thank you.